Okay, so this is the handout that you already have in your possession, but we're going to go through this step by step, and this particular one is going to be for how to position for a 2D panoramic. Okay, so the very first thing I want you to always do is make sure you have your computer ready. We don't want to put the patient into the machine and have them stand and wait while we are addressing the computer. So have that ready to go. The next step is to come to the touchpad, and we are going to choose pan. Okay. Sometimes you may have to hit the R button to return, whether you're taking 2D or 3D, and then just remember to choose the correct program. Remember, there are several options, but P1 is your default, which is your standard pan that will acquire condyle to condyle, and then make sure we choose the correct patient size. We recommend the 4th patient because we consider that the regular size patient. So now we're ready to pull the patient in. I'm going to open up the machine just very gently so that the patient can walk straight into it and they will not be off center. The next step is to have the patient come up, and the first thing I want to do is to check the level of the bite block. Make sure you choose the right bite block for the image that you're taking. This happened to be pretty good, but I could lower or raise the machine as needed to get this ready for him to walk into. So step 1 is we're going to do grab. I'm going to have him grab and crisscross his hands onto the handles. The next step is we're going to talk about the step. Make sure they are standing as tall as possible. And I'm going to place my foot about 3 to 4 inches and have him walk up. And that creates the lean that we need in imaging. So we've done grab, step. Now I'm going to ask him to bite and confirm that he's biting correctly just on the tip of the bite block. Okay, so we've done grab, step, bite. Now I go directly to light. Okay, I always ask the patient to center the red vertical line themselves, and we want them to position that to the dip in their lip. I always use the mirror to confirm, never assume, and he is perfectly aligned. You can see it's right to the dip in the lip. Then I always come back and close the mirror. In 2D, we are going to be in control of this horizontal laser line. This is the most important step in 2D imaging. This is how we create the textbook smile. We are going to start by placing the vertical line at the bottom of the eye orbit. Then the next step is I have to evaluate where it is on his tragus. If you look right now, this is too high. And if I were to take this pan now, I would have a very flat pan, which causes problems. It causes the hard palate to be too low and can interrupt diagnosis. So I need to lower the machine. So I'm going to tell the patient, I want you to let your chin drop with the machine, but do not drop your shoulders. And I usually place my hand on the patient's shoulder. I'm going to lower the machine. Sometimes if needed, and I know I didn't open, I'm going to stretch him up just to make sure. Now I have him down. So now I'm at the eye orbit to the top of the tragus. Then the next step is to close the temple supports until the motor stops completely. And then I will very gently touch the forehead support just to give him something to lean against. Then we go straight to verbiage, which is to close your lips and swallow. Hold your tongue to the roof of the mouth during the whole scan, and do not move until I walk back in. And that's it.